What's up, my people? Welcome back to my channel, and today we are going to talk about something that is very common in people who are pregnant, and it's called morning sickness. I know so many ladies suffer from morning sickness, and according to studies, 70% of women usually suffer from morning sickness. So it's an issue that is affecting almost every other woman when they fall pregnant. And today I have a special guest. He's called Dr. David. He'll introduce himself. He'll take us through the session. Yeah, so welcome, Daktari. You can introduce yourself.
Thank you so much. I'm Odhiambo David. I'm a pharmacist by profession and the co-founder of Culture, Health and Social Innovation. It's a pleasure to be in your session again and to learn with your own morning sickness, as you've mentioned. And I believe we're going to gain knowledge and know how to respond to such kind of changes that happen in our lives. And if not our lives as men, but for the women we care about. And that's a very important thing. Thank you.
Yeah, and if you've realized, I'm bringing a lot of boy child and men in this pregnancy series because I want now us as ladies and them as men to actually understand what we actually go through when people fall pregnant. Yeah, so what is morning sickness?
Yeah, thank you so much. Morning sickness is, as the name suggests, most of the times when it was discovered is people had experiences of getting nauseated, feeling like they want to vomit very early in the mornings, and this was associated with hormonal fluctuations. However, most of the pregnant ladies who experience morning sickness, it's a matter of having surges of getting nauseated, feeling like you have the urge to vomit through the day, and it's because of the hormonal fluctuations in your body. And it's a process in life. It's not kind of a serious medical condition, but that is how we need to respond to it, by acknowledging it's something that happens to us.
Yeah, it's true. So usually it happens in the first trimester. Yeah, but there are some instances where it can trickle down to the second trimester. And there's an extreme form actually of morning sickness that we can talk about before now we go to the causes and everything. So we can talk about the extreme cause of morning sickness, which is called Hyperemesis Gravidarum. So Daktari can talk about that.
Okay, thank you so much. So as my host has mentioned, we have it, the main component is it comes within the first trimester of pregnancy. That's the first 3 months of pregnancy. So after the first 2 weeks, that is after 14 days of being pregnant, then you have the implantation taking place, the development of the fetus, the child that is in your body growing. So with those hormonal changes, there's that kind of urge to vomit that comes with it. And then in the extreme forms of these, as has been mentioned, Hyperemesis Gravidarum is where you have a higher risk of vomiting at any one point in time. And then in case you're getting to eat, normally even individuals when we're not pregnant, we have the urge to vomit when we take certain kinds of foods, when we interact with certain environments, and even those people who are traveling, motion sickness we call it. So in all these components of how things translate in our lives, in this case somebody manifesting with Hyperemesis Gravidarum, they have a higher tendency to vomit compared to every other person in the population. And as from the data that was mentioned, 7 out of 10 people have a risk. So for these people, they might be the minority, even 2 out of the 10, but they have a higher tendency of vomiting as such. And what would be indicative is, 1, this person will experience weight losses of up to 5% of their normal weight. If you are like 100 kgs, then you get to up to 95 over that period of vomiting, because there's no nutritional nourishment of your body, and that is a loss that you experience. Other than that, there's that kind of dehydration, because when you're vomiting, there's no fluids in your body. And then there's the electrolyte imbalances. You are losing a lot of water, but you are not replenishing, because whenever you take anything, you drink any waters, you feel the urge to vomit. And when you don't retain anything in your body, you lose the weight, electrolytes are not there as much, you get to be dehydrated, and there's a way that we need to now find ways of taking care of such kind of a critical situation. As I mentioned, morning sickness generally is not a critical thing as a medical condition, but if it progresses to the Hyperemesis Gravidarum, then now there's need for medical intervention, and that is where we now have to put in place measures to ensure we secure your well-being as a person and the well-being of the child developing in you. Thank you.
Yeah, so we've talked about now the Hyperemesis Gravidarum. So how does someone now differentiate between the normal morning sickness and now Hyperemesis Gravidarum? At what point as a patient should I know that, hey, I'm transitioning from now this state to this state, what are some of the signs and symptoms that someone can have so that they know now they have hyperemesis gravidarum?
Yeah, so that's a very critical bit. So normally most people will have that experiences, but for the hyperemesis I've mentioned, the very critical things you realize, you're losing weight, you can't feed continuously over a period of time. Normally, let's say you used to have 2 slices of bread. You can't have 2 slices of bread. Maybe you'll have a bite or 2 and you feel like you have the urge to vomit, so you'll stop eating at that point in time. The normal, you're encouraged to have nutritious meals. In that context, when you have hyperemesis gravidarum, your tendency and the urge to vomit is heightened. So what do? These are the people who will go for maybe just snacking instead of having a whole meal, which is nutritious for them and even for the child that's developing. So these are critical things that you'll identify. There's that kind of progression where you tend to shy away from the normal food that you used to take. And when that is happening, you realize you are going to an extreme state. And definitely if you acknowledge that you are pregnant, it's a pointer that that's the case. And for some people, they might not even know that they're pregnant. And therefore, when you have such symptoms, you need to get checked, do the pregnancy test, and know what you are dealing with at that point in time.
Yeah. So also to add on what he has said, you can have also, you can be feeling like fainting or dizziness, yeah, when you have that hyperemesis gravidarum. So you vomit a lot to the extent of being dehydrated and to the extent of you're just feeling you're so tired, you feel like you want to faint, like you're so dizzy. Also, you'll notice that your urine production will be very, very low because you're not taking a lot of fluids, and you'll notice the color of your urine will also change. Normally, the color of urine is supposed to be clear, but when you're in such a state, it will be yellowish in color. So when you're pregnant and you have morning sickness and you experience some of those signs, please rush to the doctor because you're tending towards the bad side, because the hyperemesis gravidarum can even complicate. You can even go into a coma. You can even die because of just simple nausea and vomiting because of pregnancy. So if you're out there and you're pregnant and you're experiencing this, make sure you talk to your doctor about that. So we can look at now, how do we prevent now the morning sickness or the hyperemesis gravidarum?
Well, to start us off, definitely we can't prevent it as much because these are manifestations that happen in our lives, but we can control the nausea and vomiting and the severe consequences. As has been mentioned, the symptoms that are severe, you can get dehydrated and even get to a point of dying from it. But how do we prevent it? Because you need to be nourished, that is why you need to eat, and avoid vomiting where you lose that food. So you can move towards taking bland foods that we suggest in terms of what are the key triggers to vomiting. There's some people who can't take plain milk. So in that case, consider taking an alternative or taking just tea without the milk in it. That's one. 2, if you have fats are normally triggers for you, you'd have food that has little amounts of fat or oil that is used in making it. And that is easier because you'll get the nourishment that you need from the food, but at the same time, you don't get the triggers. Another critical thing for some of the triggers in terms of the food, you can take small quantities over a long period of time instead of eating 2 large quantities at the same time to let that food get into your body. Then drinking of fluids, it's required because we have the dehydration and electrolyte imbalances that had been mentioned, and you need to ensure you take small quantities of fluids and drinks over a period of time so that you are nourished, you are well hydrated as is required of you, and that's a very important bit. Other than that, we have other concoctions that you can use, ginger, lemon. Those are recommended because they have the component of helping you lessen the symptoms, and at the same time, because of the sourness, even some of the anti-nausea medication, they have the sour taste in them, and those are very important in managing nausea and vomiting. Yeah, that is the main thing.
Yeah, so to add on that also, when you're taking your water, because I know when you take a lot of water at the same time, it might trigger you to vomit. So you should take small frequent sips of water because you need the water for hydration. Also, you can get fresh air. Make sure you stay in a place where there's fresh air, because sometimes you realize that the nausea and vomiting comes about when you're maybe in a stuffy room or maybe you're traveling in a matatu or something of the sort. So make sure when you're in such places, open the window. Yeah. Because I know kuna some people who never like actually opening the window of the matatus, and not even there's corona, so we need all that aeration. So make sure you stay in a place that has at least a lot of fresh air, because That will help in controlling the nausea and vomiting. So we've talked about now the general management, what you can actually do at home in order to control your morning sickness, yeah? And then in cases where now it's going severe, Doc is going to tell us now what you're supposed to do. When it's now too severe, you can't even, you've tried the home remedies, they're not working. So Doc will share with us what you're supposed to do.
Okay, thank you so much. So as a person, probably you'll have these symptoms that you feel you're having morning sickness, the symptoms are getting severe over time, and you feel like you need an intervention to be put in place. First thing, whenever you feel discomfort and not so okay health-wise, you need to seek medical intervention. Go to a hospital, go to a doctor, get help to know what would be the critical conditions that you're suffering from and how you need to be managed. In this case, you know it's morning sickness, it might be severe form, the Hyperemesis Gravidarum. So you go to a hospital, the doctor will assess your condition, develop a treatment plan, and majorly the drugs that are being used, we have antihistamines, anticholinergics, a couple of drugs. And these will be indicated by the doctor based on how they've assessed you. And the other thing that we have to acknowledge, these drugs respond to your conditions, and you might be having other medical conditions, and they might even have interactions. So it has to be decided upon by the doctor and the pharmacist who review your treatment plan. They optimize it to ensure it's ideal for you, and then you get better from taking it and complying by the same, knowing that that is what is best for you to achieve the positive treatment outcomes that you desire. Thank you.
Okay. Yeah, so if you have any questions relating to morning sickness, and if you also had morning sickness and you are able to use other remedies that we've not tackled, please leave them down in the comment section so that we can be able to interact.
Agriculture, Health and Social Innovation is a social enterprise that's committed to improving access to healthcare services and empowering young people to make healthy life choices. So generally the kind of work that we do is around health advocacy, health research, health communication, and human capacity building. And that is the overall scope of what Agriculture does through community outreach initiatives, training programs, conferences and summits, and different interaction platforms. Make sure to check us out on our website, that is ryculture.org. Our social media handles, that is Twitter, Instagram, Facebook, Agriculture, Health and Social Innovation. Thank you so much.